Current situation in the Pakistan is very gloomy, and we are ranked among the top 10 countries of the world where the diabetes is becoming an epidemic. Presently, we are having more than 7 million patients of diabetes, and by year 2030, we'll have more than 11 million patients. So you can well imagine how the big problem is there. And the people of the diabetes is such a problem that people are coming up with so many complications. So we are not having resources to combat these kind of complications. So the picture is quite depressive one. We have got a very interesting result, especially we are lacking baseline data, recent baseline data as far as the Pakistan is concerned. So in Pakistan we had more than 700 patients, and there were 57 centers. So you can say that every city of the Pakistan we have the enrollment of the patient in the ACHIEVE study. So after the introduction of biphasic insulin as part, which was the main treatment modality in our population, so there was A1C reduction of more than 1.7%, and more than 20% of the people, they achieve the ADA goal. So you see the baseline 1.4%, now you have more than 20% the people achieve the goal. And there is definitely improvement in the fasting plasma glucose, more than 60 milligram, and you had the improvement in postprandial glucose level, more than 100 milligram, and there is improvement in the lipid profile as well, which is one of the risk factor for the cardiovascular morbidity and mortality. So when you start insulin in the patient, definitely you gain more weight. So there is actually the fear of hypoglycemia and the weight gain. So there is no major hypoglycemia as far as this study is concerned, but there is modest increase of 1.2 kg. But when you compare with the previous study, you had the weight gain of more than 5 kg. So definitely you have the benefit or the edge with this kind of treatment. You have to mend the treatment accordingly, because with the passage of time you have to modify the treatment, you have to intensify the treatment, you have to change the treatment. So there is definitely need to have clear the concept among the physician's mind as far as the patient's mind, because there is inertia in this as far as the patients are concerned, as far as the physicians are concerned. One can go to this site and he can see all the results of Pakistan, and he can compare globally with the rest of the world.